So one of the really exciting things about this meeting and several of the other meetings around this time is the transformation of what SMA. We have a real potential for changing the course going forward. I didn't think I was going to say that because I started this career managing a loss and didn't really have the expectation that we would be able to be talking about how best to make things better. So, wow, incredibly special. I also want to make certain that we don't lose sight of the fact, though, that kids and adults who have SMA are abled people. They are extraordinarily skilled. Oftentimes, they're functioning at exceptional levels despite profound weakness. And I'm worried that all the hype and all the enthusiasm and all the talk about success and all the more success, folks who have SMA now are going to feel left behind, do feel left behind. And I'm mindful of the fact that that can act as kind of a shiv. That's kind of an assault to folks who are not going to be able to experience it because their weakness has already progressed. And so I really don't want to lose sight of the fact that these people who have weakness have extraordinary abilities, and we cannot lose sight of the fact that a primary mission is to make it possible for those extraordinary abilities to bear fruit.
We still have to consider the burden of the treatment and the cost of the treatment. I think it's important to speak beforehand with your patients and to try to settle a realistic expectation. And that's the reason why it's important to have data in the literature. Because there are good responders, there are patients who are doing really well, and there are patients who are not so good responders. And so I think it's very important before starting a treatment with a patient to try to settle realistic expectation and to try to have a goal. Say, well, let's consider that this is a realistic expectation and that if we can achieve it within 1 year or 2 years of treatment, it's worth to continue. But I think that before initiating a treatment, we should even consider when to stop it, when we will consider that the treatment is not useful and that the burden for the patient and the price for the society outstands the benefit for the patient. This can be defined beforehand, and having data helps to better understand what we can expect from a treatment.